Hello my dear students, welcome to my channel. Today we are going to discuss the general aspects of pediatrics case taking and examination. We all know unlike an adult case, very difficult to take a pediatric case because it depends upon the mood and behavior of our children. But it's very interesting to interacting with a child. So you have to get some instruments for pediatric examinations. The first and foremost is toys. You should have some age appropriate toys. Second thing are toffees. Third only your stethoscope, measuring tape, torch, knee hammer, chalk, scale and other instruments which are required for nervous system examination. Before starting the history taking, you should remember you are dealing with a child. So you should always be gentle. Respect the mother or father or any bystanders. Respect the child. Be diplomatic. Don't consider a child as a mere case. Consider them as a human being. Okay, so you have to take a consent from the bystanders and the child. If the child is old enough to give the consent, should take the consent. Second, should make a rapport with the bystanders and the child before starting the examination and history taking. Okay, so spend 2 or 3 minutes for making the rapport. Then only you should go to the exam history taking proper. So the first thing is biodata. What do you mean by biodata? Biodata means the name, age, gender, the address included under biodata. Then you should mention about who is the informant, whether mother, father, grandmother, who is the informant for your history. Then you should mention whether the history is reliable or not. How will you assess the reliability? The first thing is whether the child is living with this particular person who is giving the history. So if the child is in a hostel, then the details mother may not be knowing. So that's very important. Second thing, relationship. Mother, father or grandmother, grandfather may be knowing the history very well, but if it is a distant relative, they may not be knowing the history. So then the educational status of the informant. By this, you are finishing the biodata. Now we are coming to presenting complaint. The presenting complaint, you should mention the most important complaint to which the patient came to the hospital and should mention it in a chronological order. For example, we have a 5-year-old boy who came with fever and cough. So the presenting complaint will be fever of 5 days duration, cough of 4 days duration. That finishes the presenting complaint. Even if it is a cerebral palsy child who is coming with some respiratory symptoms, so you should mention is the respiratory complaint as the presenting complaint. Okay, and the third heading after biodata, the presenting complaint. Then third one is history of presenting illness. History of presenting illness, you are elaborating the presenting complaint. So first about the onset, then the duration, then the progression. For example, it is a fever. Fever started 5 days back. It was low grade to start with, then it progressed. Now it's a high grade fever. And it's associated with cough. Initially was a dry cough. Now it is a moist cough which was associated with post-acute vomiting. So you can explain like this. So onset, duration and progression of the presenting illness. Then you should mention some aspects of the associated symptoms. For example, our current child has fever and cough. So you should ask about the associated symptoms like whether there is any history of breathlessness, nasal discharge, sore throat, ear discharge, like that. Depends on the presenting complaint. Third thing, you should elicit some negative history of why the symptoms occur, like the etiological factors related to the presenting complaint. For example, it is a fever and cough. You can ask about the history of aspiration, whether aspiration of feeds, aspiration of foam body, like that. Now, next history, you should ask about the complications, symptoms that is related to complications. Like, for example, if it is a respiratory case, you should ask about the history of cyanosis, history of seizures, history of stridor or any other noisy breathing, history of lethargy. These are indicators of severe pneumonia. Okay, next you should ask about the hospitalization details. That is, for how many days he has been in hospital. Like initial first 2 days he was in ICU, then he was shifted to ward. The history of hospitalization you should mention. Then the sixth thing, you should mention about the activities of daily living. Whether the symptoms is affecting his daily activities, like his sleep, his food intake, his playing, whether everything was affected or not. So once again, you have to take the onset, the duration and the progression of the illness, detail about all these symptoms. Then you should ask about some of the associated symptoms, then the etiological factors which has led to the current situation, then about the complications if any, then the hospitalization details, then about the activities of daily living. By this thing you are finishing your history of presenting illness. Now we are going to the fourth heading, that is history of past illness. Should mention about the whether was there any history of the similar complaints in the past, like history of recurrent hospitalization for respiratory tract infections, history of ICU admissions, or history of nebulizations requirement, and other history like some vaccine preventable diseases, history of tuberculosis. For example, if it's a case with acute glomerulonephritis, you can ask about the history of sore throat in the past. So by this thing you are finishing your history of past illness. Remember, this is not past history, this is history of past illness. Now we are going to antenatal history. So in the antenatal history you should detail about the first trimester, second trimester and third trimester. So in all trimester you can ask about the pregnancy induced hypertension, PIH, gestational diabetes mellitus, any bleeding during any of these trimesters, urinary tract infections, fever with rashes, which all indicates your torch infections, any drug intake during the antenatal period, especially the teratogenic drug. You know what is teratogenic drug? Teratogenic drugs are the one which harm the fetus. For example, your sodium valproate, it can cause neural tube defect. Your phenytoin, which is an anti-epileptic drug that can cause fetal alcohol syndrome. Lithium, it can produce Epstein anomaly. Warfarin, it can produce warfarin embryopathy. So you should elicit such history. Then you should ask about the frequency of antenatal visit. It's recommended that at least 3 antenatal visits should be there during the whole antenatal period. Then you can ask about the tetanus toxoid. 2 doses of tetanus toxoid is a must for a pregnant mother. And you can ask about any other relevant history, like whether maternal fever, premature rupture of membrane during the late 3rd trimester. You can ask about the history of ultrasound examination during the trimester. You can ask about the fetal movements also. When did it start and how was the frequency of fetal movements? Decreased fetal movements is a feature of some of the muscle diseases, and in fetal distress also you can get decreased fetal movements. Increased fetal movements you can get in intrapartum seizures. Okay, so by this thing we are finishing the antenatal history. Now we are going to the natal history. The natal history should detail about the mode of delivery, whether it was a normal vaginal delivery, whether it was a cesarean section. If it is a cesarean section, was it emergency, was it elective? If it's a vaginal delivery, whether it was instrumental like vacuum or forceps delivery, and whether there was any history of prolongation of 2nd stage of labor. Was it a home delivery or a hospital delivery? And was it a term or preterm delivery? That finishes your natal history. Now we are going to the postnatal history. The most important point is, did the child breathe? Did the child cry immediately after birth? That is very important question. What was the birth weight of the child? How was the feeding pattern during the initial periods? Whether baby required any NICU admissions? Was the baby suffering from some common conditions like hypoglycemia, jaundice, breathing difficulty, similar complaints? You can ask about that. So important postnatal history. Now we are going to the developmental history. Developmental history you should elicit in 4 important spheres, like the gross motor, the fine motor, the personal, social and language. In addition to these 4 points, you should ask about the vision, hearing, and if it's an older child, the scholastic performance also. So that finishes your developmental history. After that, from history, you can mention the DQ, the developmental quotient of the child is such and such value. After the developmental history, should ask about the dietary history, and otherwise it's called nutritional history. You can ask about the important points during the immediate postnatal feeding, like when did the mother start feeding the child? What was the feeding pattern during the initial days? When did the mother start complementary feeding, family pot diet, how long the mother fed the baby with breast milk, like that. After that, you should give a detailed nutritional history, like that is by your 24-hour recall method. So what do you mean by 24-hour recall method? You are recalling the dietary items or food item the child consumed during a 24-hour period. That should be before the onset of the illness. That is very important. After calculating this nutritional value of particular food items by 24-hour recall method, we should say the child is getting this much calories against an expected of this much calories, getting protein this much against an expected of protein this much, and there is a calorie gap of this much calorie and protein gap of this much. Okay, we will be covering the nutritional case in another class. This is only an overview. In the nutritional case, you should ask whether the child is a non-vegetarian, whether the child is taking a mixed diet. Does the child's diet contain adequate food items providing like iron, calcium and all? After that, we are going to the immunization history. Immunization history, you should mention the national immunization schedule, where the child took vaccines as per national immunization schedule. Then you can mention whether the child took any additional vaccines. Then you can mention about the pulse polio vaccination. These three are very important and should be aware about the national immunization schedule followed in your place. Okay, then you can examine whether there is any BCG scar present or not, and if the child is partially immunized, you should ask about the reason why they immunized partially, why they skipped some vaccines. Should elicit such history also. So after immunization history, we are going to the family history. Family history should draw a pedigree chart that should include at least 3 generations, the mother, father and the sibling and grandparents also you can draw, and whether this is a consanguineous marriage or not. You all know what is consanguinity, right? So consanguinity means the relations, like sharing of genetic material. For example, if it is a first degree consanguinity, that means the siblings or father daughter, mother son, that is the first degree consanguinity. Second degree consanguinity means your uncle and niece, that is the second degree consanguinity. Third degree consanguinity is the first degree cousins marriage. So that's the third degree consanguinity, because some of the autosomal recessive diseases are common in consanguineous marriage. That is why you have to consider you have to mention the consanguinity. Then you can mention about the age of the parents. Why some syndromes are more common when the parents get older. Now, after the family history, in the family history, you should also mention about the any other similar illness in the family. If the child is jaundiced, there is high chance it may be a viral hepatitis, and there are other people in the family who are affected with the similar complaints. Okay, if there is a respiratory infection, there is a history of contact with there will be a history of contact with a similar illness in the family. So, similar illness in the family, you can ask. Some diseases like hemolytic anemias are common in the family. So you can ask about the history of any blood transfusion or history of any abdominal surgeries. So you can ask the relevant history according to the presenting complaint of the child in the family history. After the family history, you are going to your socioeconomic history. That is very important. Don't skip this heading. It's very important. You should calculate as per the modified Kuppuswamy scale. Should calculate the socioeconomic status. Whether it's an upper class, middle class or lower class, you should calculate. And you should mention about their water source, whether it's a well water or is from panchayat water, you can ask like that. Then you should mention about their housing, is a pakka or kacha house. What about their sanitation facilities, you can ask. Then any financial support, whether they are getting from any sources, you should ask. So these are the most important points should mention in the socioeconomic history. So from starting, biodata, presenting complaint, history of presenting illness, past history of past illness, antenatal, natal, postnatal, development, diet, immunization, family and socioeconomic history. This finishes your history taking in a pediatric case. Hope it is clear. Now we will go to the examination. So examination should start with the first heading is general comment. You can comment if child is irritable, if child is crying, or child is active, playful, comfortably lying on the bed, like that, because it's very important for your further examination. After the general comment, you can start your vitals. The vitals are 4 important vitals. One is your pulse rate. Pulse rate you can examine by palpating the radial pulse, and you should mention the rate, the rhythm, the volume, character, radiofemoral delay and all the peripheral pulses. After that is the respiratory rate. You should mention the respiratory rate, its rhythm, rate, rhythm and the type of respiration and whether the accessory muscles are acting or not. Then blood pressure. After measuring the blood pressure, you should mention blood pressure is this much, 100/70 millimeters of mercury in the right upper limb in the supine position, and you should mention whether it's normal or not for that particular age. Next is temperature. You can measure in the axilla and can measure the temperature of this baby is this much and it is normal, or child is febrile, or child is in hypothermic state. You should mention your inference too. After this vitals, we are going to head to foot examination. So head to foot examination start from the head. Head, you can mention about the head size, head shape, about the anterior fontanelle, whether it's wide or it's small or it's bulging or it's depressed, like that. Next, sutures, whether it is separated or whether there's an overriding. You can mention about the hair pattern, whether hair is sparse, easily pluckable, the color of the hair you can mention. After the hair, you can come down, can mention about the facial dysmorphism, if it's present or not. You can examine the eye for the pallor, the jaundice, any bleeding, any features of vitamin deficiency. Can come to the ear, you can mention whether it's a low sit or normally sit, any preauricular tags, any ear discharge present or not. Nose, any nasal discharge is present, any deviated nasal septum is there or not. Coming to oral cavity, you can mention about whether there's any glossitis, cheilitis, angular stomatitis, any gingivitis, what about the tonsillar pattern, how many about the dentition, any caries present. Can come to the neck, any webbing of neck, any lymphadenopathy, cervical lymphadenopathy, jugular lymph nodes enlarged or not. Can whether there is any thyroid enlargement present or not. Can come to chest, can look for any abnormality or asymmetry, pectus excavatum, pectus carinatum, Harrison sulcus, any rosary, any scars, any distended veins. Can come to abdomen, you can examine whether it's distended, any umbilicus discharge is present, any umbilical hernia is present, any scars. Can go to the external genitalia if there is something undescended or if there is any other features like hernia, you can mention. Can come to the extremities, the skin and the nails, you can mention the important points if present. So then back, don't forget to examine the spine and the back, that is very important. After the head to foot examination, you should be going to the anthropometry. Anthropometry will be discussing in another session. So you should mention about the weight, the height or length of the child, the head circumference, the mid-arm circumference, the chest circumference, the arm span, the upper segment, lower segment ratio, all the important measurements you should mention in the anthropometry. Next is developmental assessment. Initially, we took a developmental history. This is developmental assessment. You are assessing whether this child's development is adequate for this child or not. Again, we are going to the major examination part, that is systemic examination. So, since our child presented with fever and cough, we can go to respiratory system first. After respiratory system, we can go to the cardiovascular or neurological system as per the examination finding. So, the most important systems are nervous system, cardiovascular system, the respiratory system, gastrointestinal system, genitourinary, musculoskeletal. After examining all this system, should come to your final diagnosis. Always mention a complete diagnosis. So, let it be a cardiac case presented with respiratory infection. So, how will you present the final diagnosis? It is a cyanotic congenital heart disease, left to right shunt. Most probably it is VSD, a large VSD with features of congestive cardiac failure without pulmonary arterial hypertension, in sinus rhythm without any features of infective enterocarditis. That finishes your cardiac diagnosis, and you can now presented with bronchopneumonia with grade 2 PEM, first degree stunting, first degree wasting, partially immunized with normal development. So all these points should come under your diagnosis. That is very important. Hope it's clear. If you have any doubts, you can ask me in the comment section. I am ready to answer. We'll meet you soon for the next session. Bye.